to foreign bodies in the ears, nose, and throats of children. But here's the great thing. We are not only going to talk about children, we're going to talk a little bit about adults, because as adults, we have sometimes at some point found ourselves in such situations before. And so I have an expert in the building today, and he's going to tell us all that we need to know about foreign bodies in your ears, in your nose, in your throats, the damages that they could possibly cause. You know that children have this fascination about putting objects in their ears, in their nose, swallowing it. When I was quite little, one thing that my mother and my aunties would deter me from is when we are eating fruits that has seeds. They would deter us, my siblings and I, from swallowing the seed. And they would tell you that if you swallow it, the seed it would germinate in your stomach. And so when you hear it, you will get scared and you'll be very skeptical about, okay, if I'm taking fruits and there are seeds in it, I need to be very careful. But these are all stories, so, some myths that we heard growing up, just to make sure that we would flee from such accidents from happening. I have seated with me this morning Dr. Kwabena Ejanim Boateng, who is a resident ENT surgeon. Good morning.
Good morning.
How are you?
I'm great. Isidra.
Yes.
How are you too?
I'm doing great. I'm doing great. Off air, I told you that I have a question, a personal question that I would ask you. So we'll talk a little bit about the adults one, then we'll get into the children. And so viewers, please and please, if you have a relative or a loved one who has a child, please call them right about now. Let them know that a very interesting conversation is about to happen during Good Living segment on Prime Morning. Let them tune in, or you can go to our Facebook. It is Joy Prime. Don't add the TV, and get interactive with us. Any questions at all that you have to ask, or if you've had an experience that you would want to share with us, Doc is here to answer it all for you as well. So make sure you get interactive with us. Now, Doc, let's get started with identifying foreign bodies. When we say foreign bodies, what are they?
All right. So for the purpose of this discussion, foreign bodies refer to substances or objects that are inappropriately situated in a particular anatomical location. Okay. So in medicine, we use terms like anatomy. We mean the structure of your body. So there are particular places in your body that we expect to find some things. And so if you have a substance or an object, for the purpose of this discussion, that is located at a place that is not supposed to be. Yes. There. So typically, you would have put it in, and it's located somewhere it's not supposed to be. Yes. For instance, I have a bead. I find a bead in someone's nose. I don't expect to find bead in someone's nose. So in that case, that bead in the nose becomes a foreign body. It's an object that is inappropriately located in the nose, essentially so. So those are when we talk about foreign bodies, that's what we mean. Maize, corn in the ear.
Yeah, cotton swab,
marbles. Finding itself in various places, coins in
sometimes when you look at the sizes of these objects, you wonder, how did they get there?
I'm telling you. It's amazing. And it's all because the particular age group that you're talking about now really is children. We'll talk about other people as well.
Yes.
And like you rightly mentioned earlier, they like to explore.
Exactly.
Explore with all kinds of things.
Yeah.
And it's amazing to what extent they can do so. And commonly we find them doing all these into the ear, into the nose, into the mouth, because, our field, that is the ear, nose, and throat. I'll borrow the words of one boss of mine. It has plenty of holes.
Yes.
Plenty.
Yes.
So you have the nose, you have the ears there, you have the mouth.
The mouth,
yes. So they keep on exploring and put things here, there, that kind of thing. So it's all out of curiosity that you find sometimes some things that are of certain sizes that you don't even expect to be able to get inside there, but they manage to push it inside there.
Let's come to the instances that these things could happen.
All right. So in the first place, for our age group, that's the children, yes. The fact that they are also curious and want to, from about age 6 months onwards, they start mouthing everything. Yeah. And then, trying to explore with other things and all. So typically in age groups about 0 to 4, yes, you typically have some of these. Other children, older children can be in there as well. but typically around these times, these ages, just because of their curiosity.
Curiosity.
Aside that too, there are some of our children that are a bit more hyperactive than other children. Yes, those that unfortunately suffer from the attention deficit, hyperactive disorders and other things. So they are at a greater risk because they are a bit more uncooperative compared to other children and all. Then also children that for some reason or the other have some neurological damage. What we mean is that their brains has suffered some injury.
Right.
And so has become impaired in a way. So they are unable to also cooperate with parents and instructions, unable to
even
understand.
if they are told, they
Yes,
can't understand.
They can't understand it. So they end up, putting things in place. So for instance, if you find an older child, if you have a 7-year-old, 8-year-old that has, for instance, put something in the ear, among the things that we want to be sure about is whether this child, in terms of the neurologically, in terms of the developmental milestones, is this child normal? Because we don't expect you at this age to do something like this, So something as simple as a foreign body that you have brought can actually help us to maybe diagnose a neurological issue that your child may have had because of the age group that your child is in.
Now, speaking of on diagnosis,
Yeah.
is there what's the probability of there being a misdiagnosis depending on the stage of whatever? Maybe there's something in the ear.
Yes.
What's the probability of misdiagnosis? Is there any such?
Oh, there is. There is. Things that there are probabilities for whether things that have been inserted in the nose or the ear or something that a child has inhaled. Sometimes they've even choked on something, and yet we miss it. Even though choking is seen as a big thing, and it is actually, it's indeed a big thing, but you can end up missing choking, for instance, if the thing happened in school. And because there are various phases of this choking, so for instance, a child could have choked on something like granite whilst chewing. It went the wrong way.
But there are no symptoms showing.
Yes, so at the time that the child came home. So in school, they may have had a sudden onset of coughing and choking and difficulty breathing.
Right.
But at some point, it settles. And
but it's still there.
Yes, it's still there. Then it settles within the same day. Then maybe at night whilst you are asleep. Now your child starts having some noisy breathing that you are not used to. And it's because it was missed at the time he came home. He didn't come and tell you. Some of our children are afraid they'll be beaten.
Yeah.
Yes. So they will not come and tell you.
Yeah.
Yes. And we all remember when we were children, and if you go and steal from your mother's soup, and somebody is opening the door and coming
you
and
swallow
everything. Swallow that
yeah,
thing, yes.
You swallow
so
it.
imagine a child was swallowing this thing. And then while swallowing, the thing went the wrong way. He's afraid to come and tell you, the adults, in the first place, because you might have warned him or her several times not to do what he did and other things, yes. And so at the time when the silent phase of it, you may not know anything until later. And things in the ear, similarly, sometimes you are syringing or washing a child's ear because of wax that's impacted over there, and you realize that, oh, there's actually something the child had put in the ear, and nobody realized that there was anything there. And then in the nose as well, sometimes these things happen. In the nose, there are some telltale signs that we would encourage parents that are watching us to look out for. So for instance, yes, your child may be having runny nose, but it's just one nasal cavity. Nasal cavities are two, left, right, yes. But one nasal cavity alone is always having runny nose. And you are there complaining, my child always has runny nose. But if you look at it carefully, it's actually just one. And that is where the foreign body could be located. There's something there. Yes, that is giving just one. So anytime you have just one nasal cavity discharging, and many times it's also offensive. It has a smell.
Okay.
Understand that something may be there. In fact, we have is it an axiom? Or, yes, we have a saying in our department, yes, that anytime you have one-sided nasal discharge in a child, it's a foreign body until proven otherwise.
Okay.
Yes.
Okay.
Yeah.
I think it's better to be put that way.
Yes. Yes.
Right.
Yes.
Okay. So, Doc, I want you to help us. Let's start with the ear.
Yes.
Okay. There's this myth out there that if you, let's say you're using a cotton swab to
Yes.
clean your ears, if you
Yes.
go in too deep,
Yeah.
you could be hitting the eardrum and you
Yes.
could go deaf.
Yes.
Now let's look at a foreign object entering the ear,
Yes.
staying there. What is the probability of damages being caused there?
Okay. So the foreign objects in the ear causing damage depends on, one, the type of foreign body that is there, and sometimes whether it was inserted traumatically or otherwise. So a child may be playing, so in terms of trauma, a child may be playing with, say, the earbud,
Yeah.
and suddenly jumps and hits the head against something, then that earbud that he was holding now just traumatically inserts.
Okay.
That kind of thing.
Okay.
And that circumstance are going to rupture the tympanic membrane, that's the eardrum, maybe other structures. So, I mean, in such a circumstance, if you have damage later on, it's not so surprising. And once your eardrum is perforated, your hearing certainly is going to be reduced. Yes, because it plays a role in the amplification of the sound and all. So your hearing is certainly going to be reduced under such a circumstance. Then the nature of the foreign body. If you have something like, amongst the take-home messages that I would want viewers to have, is the thing called disc battery. The batteries, those flat batteries in watches, in children's toys,
Right. The small one.
Yes. That's this battery is a hazard in waiting. If this battery enters the ear, it's a problem, because immediately, because of it has a charge. So the electrical discharge, and among other things, the leakage of the alkaline, most of the time it's alkaline in it. The leakage of the alkaline into the tissues around and other things causes severe damage. So for the ear, something like this battery, once it is identified as an emergency, we need to take it out. And when it comes to even the throat, talking about whether into the esophagus, that's where food passes, or even worse still, into the airway, when it comes there, that's even a worse situation. Immediately we find anything like that, there and then we have to go and take it out, because it's such a severe hazard, and will cause not only damage now, but it will give you complications that will follow you in the future.
That is problem with your hearing.
A problem with your hearing. So it's, so the nature in terms of things like this battery, and then maybe the trauma with which the thing was inserted,
Now let's go back to the cotton swab thing that I mentioned.
Yes.
How deep or how far can you go with cleaning your ears?
Okay, so the point is this: don't clean your ears. You are not supposed to be cleaning your ears with cotton swab or any other thing. Yes, I know the convention. The convention is that your ear, just like other parts of your body, has got to be kept tidy, and so clean it and all of those things. But it has no scientific basis. And we actually realized that cleaning your ear gives you more problems. Yes. Many people that have come around with infections of the external ear was because they weren't cleaning the ear, and the skin in the ear was traumatized, and germs, started the activity, and then an infection ensued.
Are you talking about when you go to an ear center and want to have your ear canal cleaned?
Yes.
Or just at home with the cotton swab?
At home with your cotton swab. That's what I'm talking about.
Oh, wow.
At home with your cotton swab. So the point, maybe I should reframe it. Don't attempt cleaning your ear with a cotton swab or any other thing at home. If you think there is a buildup of wax in your ear, go to an ENT center. Let them syringe or wash your ear, in quotes. That is the safest way to get rid of your wax that is impacted, and not the cotton swab and all. So the action in the first place is one that we don't encourage at all. And then the action comes with the other issues that you are talking about, the thing going so far and all of those. So in the first place, you are not supposed to do it, let alone to tell you it's supposed to go this level or that level.
So going to the ENT to get to get it washed and all that, how often should you do that?
Oh, I think it's really individual.
Okay.
It's subjective. If it's giving you symptoms, wax in itself is supposed to be protective, but there are times when it builds up so much and becomes uncomfortable and becomes impacted so hard and other things and uncomfortable. It's under such a circumstance that you will need to, yes, for the symptoms it's giving you.
Okay.
But it's not like there is a hard and fixed rule every month or every 2 months or every 3 months you should get your wax removed. No.
If we are not supposed to personally clean our ears, what
Yes.
about children?
So the children, it's actually the same with the children. We are not
Even
supposed.
babies?
Yes, even babies. Even babies. For many of them, the wax in there actually does not give them any adverse problems.
Okay.
So why trouble this young one with attempting to clean the ear? And eventually, children are highly uncooperative. So when you attempt to
moving
clean
the
it,
head and all that.
Then you come to us that now my child is bleeding from the ear.
Viewers, we are still talking about foreign bodies in your ears, nose, and throat, not just in children, but yes, we want to bring adults into the conversation now as well, but we are focusing more on children. I have seated with me Dr. Kwabena Ejanim Boateng, who is a resident ENT surgeon. Please start sending in all your questions. We've said quite a lot. And one thing that has stood out for me so far is the fact that you personally cannot clean your ears. You cannot take cotton swab. Those of you who right after bathing, which I fall victim of, right after taking a shower, I assume there's water in my ear. So I take the cotton swab and I clean it.
Oh, look at you. So if you are concerned about water, rather block the ear before bathing than
to use a cotton swab. So I think that Dr. Kwabena Ejanim Boateng is about to put cotton swab sellers out of business after making this revelation right here on Prime Morning. So we're waiting for all your questions. Please send in the questions, and Doc is here to answer it all for you, Dr. Boateng. Yes. So now let's come to some of the cases that you've had to deal with all the three, ear, nose, and throat. What are some of the foreign objects that you mind-blowing? Let me just put it that way.
It's amazing.
I mean, to you it wouldn't be mind-blowing, but then to us it would be
yes. Okay. So maybe I'll start with the commonest ones that we see, and then move on.
Okay.
That kind of thing. So the commonest, starting with the throat, for instance.
Okay. So
the throat is either the foreign body is going into the airway or is going to where food passes. That's the esophagus. So when you talk about foreign bodies in the esophagus, where food passes, interestingly, it is coins that are the commonest, yes, that we have. All kinds of coins, the 50 pesos coin, the 1 cedi coin. So anytime any new coin is introduced, we know a new hazard has been brought, that kind of thing. Because I mean, and it's interesting. We don't know whether children want to establish banks in their throats or otherwise. But coins, largely are the commonest that you find. We also have disc battery. Yeah. And the disc battery is similar to the coin, but it's a dangerous one. Very dangerous. And if your child,
because of the charges that
the charges that it would is going to create a closed circuit, that kind of thing, that would damage the tissues over there. There's a leakage of the contents. Many of them have mercury, other things, other heavy metals that are leaked into the tissue, causing further damage. And then you also have the fact that it is lodged over there. It's lodged at what we call normal constrictions, anatomical constrictions. Typically, those are the places they will lodge. And there's pressure at that particular place. It is lodged over there, it's not going, not allowing the tissues to, so eventually there's damage because of the pressure that is over there. So about, 3 or more mechanisms that causes damage. And then eventually, as it goes on, it can perforate your esophagus, as in burst the part that the food goes through. And once it bursts, when the esophagus bursts, that's a dangerous situation.
And how long could that possibly take for
it can take hours, 2.5 hours. 4 hours, yes. And your child could have a perforated esophagus because of a disc battery, especially when the battery is new. So it's important. All of us at home, the toys that our children have, it's important you know the kind of battery that is in there. And sometimes some of the toy manufacturers, and it's also because of advocacy, I mean, as we talk about some of these things, toy manufacturers change their approach to some things. And so now many of them screw the part that has the battery so that your child cannot have access.
Open.
Yes. So the point, so the point is that it's about being very, very vigilant because that thing also is a common one that we have. And it's a dangerous one. Immediately we find out that it's this battery your child has taken, right away, that battery has to come out. Unlike a coin that you can afford to buy some time and other things, this battery has to come right away.
Right.
And unfortunately, this battery and coins can be similar. Some of these batteries are like a size of a 20 peso coin or 50 peso coin. And so, yes, it becomes confusing sometimes, especially to parents and all. But once you suspect your child was playing with a battery, you can't find the battery now, your child is attempting to, is trying to gag, retching in an attempt to remove something, you better get the child to the hospital, get an x-ray done, let it be confirmed, and then taken out as quickly as possible. Okay. So that's also among the things that we have. We also have children swallowing peg hooks, the metallic thing in pegs.
Peg hooks?
Oh, yes. I brought some images. If they can be uploaded for viewers to see. The peg hooks, the hooks that we use in our pegs, the metallic hook that it has in there. It's one of the commonest things also that children swallow.
Wow.
Yes, and that one too is dangerous in the sense that it has pointed edges. Yes. And so sometimes even in retrieving it, it can be a problem. Yes, we found ways to get around it so that it doesn't cause damage. But the point is that it's a dangerous thing. It's hazardous. It can be such a terrible nightmare when your child ends up swallowing a peg hook. So parents, pegs are things that we all commonly use.
Yes.
Every one of us. Don't keep your child unattended to playing with your pegs and other things. By the time you realize, something else would have happened. And it can be a very terrible situation. Something as simple as pegs. And then you have trouble, that kind of thing. And then other weird things, your earrings. Your child can take your earring and swallow. And one of them that I saw that I was actually, I myself was surprised, is a padlock and the key. Both the padlock and key swallowed by a child. Both the padlock and the key. How old was the child? Well, I can't remember of it, but it's one of these young ones. Both of them swallowed, and we had to go and retrieve them. I brought images of all of those ones. So there are a whole variety of things.
I hope that we would be running these images whilst we are talking, so I can ask Doc some more questions in relation to them. Because this whole padlock and key,
it's amazing. It's amazing. Swallow a padlock and key.
Wow.
It's just amazing. So children explore, that's the take-home message. And ensure that you keep an eye on your child. Don't leave your child unattended. Yeah, it can be a problem.
Okay, now let's come to the nose.
Yes, so the nose beads.
Beads?
The common, among the common things that you can have, beads.
Okay.
So beads, and then the what we use in making children's ribbons and other things. So when you are braiding your child's hair and you are thinking about things to put in their hair and all of those, bear in mind that this child may end up taking one of them and putting in the nose.
Yes, they are always pulling.
Exactly.
Yeah.
So he may, or the child herself, herself may not, but a friend in school may pull it and then put it in there. So beads is among the common thing, or the ribbon stuff. It's among the common things that you have. You also have organic things like corn.
Corn?
Yes, corn put into the nasal cavity. Beans put inside there. What's the name? Cushion, the foam.
Is it the cotton thing in
Yes,
there?
the cotton, in fact, fabric, as we have these upholstery and other things. And then the foam itself, what we use, the mattresses, They take some of them and put in the nose and all. So it's a whole variety of things, put into the nose. And then also the disc battery. Some of them put it in the nose.
In the nose.
And then it ends up, with all the reactions and other things, ends up closing up the nasal cavity. And another terrible thing, aside closing up the nasal cavity, there's a division. The division between the two nasal cavities, we call it a septum. It can end up perforating it and other things.
Ooh.
So these are things to look out for.
Right.
Yeah, children do all kinds of things.
Right. Okay, now let's come to the ear.
Okay, so when it comes to the ear too, similarly, the beads that we have, corn, maize, other things, the organic stuff are put into the ear. And what we've realized is that, according to some of our literature, the right-handed people end up putting more things in the right ear. Yeah. And then the left-handed people end up putting more in the left ear. Some do both of them anyway. So occasionally you have a child that has one ear and then another there. So often when we remove one, we have to go and look again and be sure that there are no more.
They wanted it to be balanced.
I'm telling you.
Let's continue. So I want to go over there. So we reach our messages.
That's fine. That's okay.
So viewers, please send in your messages. Please send in your messages because we are still here with Dr. Kwabena Ejenim Boateng, who is here to answer. Oh, I love this. So many questions. Okay, so this one says hi. All right, let's get started with this one. Please, I would love for you to add your names when you send in the questions, okay? Let us know your name and where you are texting us from or watching the show from. So let's start with this one. It says, please, is it advisable to use inhalers? Inhalers, do you mean the one that we use when you catch a cold? I think that's what, maybe. Yeah, for the nose, yeah. That's what she means. So please, is it advisable to use inhalers? Because I'm asking this because there is the asthma inhaler also and all that. So, yeah.
Well, I think inhalers in which age group? That should be the question.
Okay.
Yes, these things are sometimes they are designed such that they shouldn't be a hazard to you. So, if it is the inhaler, as I know, whether for the asthmatics or the ones that are put in the nose and you kind of sniff, I think it shouldn't be a problem.
It shouldn't be a problem.
It shouldn't be a problem.
All right. Okay, so let's move on to the next one. Next one says, oh, my dear, it would be better to stream this program of yours. That gives you a very... Nketia. We are streaming, Nketia. My dear Nketia, we are streaming live on Facebook, so please go on there. It is Joy Prime. Don't add the TV. Joy Prime, we are live on Facebook. And don't forget to hit the share button, okay? Let your loved ones know. We are streaming live. Next one. Good morning, Esi Edouard. Thank you for discussing this. It's good to go to hospital to have it wash your ear. Okay, to wash your ear for you, but the cost involved.
Oh.
Okay, so Doc, please address that for our dear person over here.
Well,
the cost involved.
Oh, it's not a costly procedure at all. It is not. It is not. It's not. So the person should not be afraid to come to the hospital. It's not so costly to do.
So minimum.
Well, unfortunately, I'm not an accountant, unfortunately. So it's difficult to put.
Tell.
Yeah, it's difficult to put figures to them, but it's not a costly one.
Yeah,
it's not.
I mean, you can visit any ENT place and then make your inquiries.
Exactly.
Yeah, and it's not something that I believe. I mean, if you can, the availability, you can do it quite often, like Doc rightly mentioned earlier. Okay, next one. My name is Paul. Once a while, I see blood coming out of my throat. What is the cause of it? Thank you. From Accra. Doc, would you address this?
It's a myriad of causes.
Okay.
And so he should come around. He should come to an ENT facility. And let's evaluate him. Yeah.
Okay.
So we can come to the bottom of it.
Okay. So what could possibly be the issue if he doesn't come on time?
Well, whatever thing that is causing it could be a harmful cause, etiology, or something that may not be so harmful. If it's a harmful one, the earlier you came, the better. If it's a harmless one also, the earlier you came, the better. So either way, the earlier he came, the better. Because, I mean, for harmful ones, like cancers, for instance.
Okay.
Yes,
Okay.
if it's a cancer and you are waiting, at some point, at the time you are communicating with me now, maybe at a stage where it can be cured.
Okay.
And, but you're waiting, after a while, it would have spread to other places that will make it incurable. And so that's the reason why it will be good for him to come around as quickly as he can.
Yeah,
so
he needs to attend to it as soon as
yes.
possible. Next one, hey, I'm Fina from Tema. Please, sometimes I feel like there is a boil in my ears, that is both of it, and it gives me headache, and I feel pains. Is it really a boil or something else? And I was told it can kill. Okay, so I don't know if it is a professional that told you that the boil could kill you, or it was friends and family that said it, but Doc, can you please address that?
Well, anyway, unfortunately, there are many people that have attended medical school and are sitting in our houses, so many of them. Anyway, so she should, once you are feeling pain in the ear, I mean, it doesn't necessarily mean it's a boil, as she's putting it. Many things can account for pain in the ear, including things that are remote from the ear. So there are sometimes when ear pain is such that you can have a primary, as in primarily from the ear, or it can be something else that is happening. There can be something happening in your throat that is giving you symptoms in the ear.
Okay.
Yes, so the reason why, once again, she would need evaluation so we can see what it is that's the issue.
Okay, all right. So our dear lady has identified herself. The lady who sends the inhaler question says, I'm Yasantua from Tema. Good morning to you, Yasantua. Thank you for your message. Next one. Good morning. Please, I'm having swollen throats and sometimes I cough out tonsil stones. I went to several hospitals, tried and explained to the doctors, and they have given me several medications and injections, but still, the swelling is still there and the pain of my throat is increasing each and every day. Please, what should I do? I'm not at rest. This is Lisa from Koforidia.
Interesting. All right, it's fine. Unfortunately, we came to talk about foreign bodies in the ear.
Yes, our viewers
I get it. I understand. It's an opportunity to also ask other things.
Very true.
But as to what she's talking about and all, some of the things have got to be seen ourselves. And from where I sit, without having to see, giving advice would not be appropriate.
Diagnose.
So she should please pass through ENT, Kolebu, 37, other places, very good places.
Okay.
And come around. We'll be glad to see her.
All right, Lisa. So there you have it. Next one. Hi, good morning. Please, my child has a hearing problem. If you are talking to her and not shout, she will hear. I took her to a hospital twice. They said it's nothing. And that is Morris. Okay.
So the hospital was the place, an ENT place. And what did they do? There are objective ways of assessing hearing, which we resort to. So what she may be talking about is a subjective way, but there are objective ways. So once again, she will need a professional evaluation. Yes, and then we can
All right. Next one. Hi, good morning, please. Please, I'm Justina from Ejoso. Please, when a child swallows an object and you don't notice, will it cause something else to the child?
So a child swallowing an object, from our discussion, we just realized that the type of object is important. Yes.
True.
And so if your child has swallowed an object and you've not seen, you would have to pass through the hospital. And we do our imaging to find what it is. Because what it is important. And that is what will inform the agency of, of ensuring that we retrieve whichever thing and all.
Okay. Next one. Hello, Prime Morning. Hello to you too. I'm Sarah from Seshi Debeso. Is there any problem with me feeling pain in my nose? Okay, let's move on. I'm IB Man, watching you from Ejura. Please ask the doctor whether it's advisable to treat children with nasal drop when they are affected by running nose. That question.
Okay, so running nose depends on what you are putting into the child's nose. Of course, things like herbal, trying to use some herbs in the nose and other things will certainly not be advisable.
Okay.
But there are medications that are used in the nose. So if he's talking about having to administer drugs through the nasal route, yes, we have medications that are approved
for children
for that purpose. Yes.
Okay.
And so it is not entirely wrong, but it depends on what you are using.
Okay. But I think that they need to be very careful as well, not to
Exactly
just go
so.
to the pharmacy
And then pick
buy nasal
medications.
drops and use for their children.
Exactly. Because there are some of them that are meant for adults, and you end up using for your child with all its problems that it can give you.
True. Okay, so our gentleman Paul, who was asking about the blood coming out of his nose, he says that he already had a surgery at Kolebu Teaching Hospital. And he's having that effect.
No problem. But I don't know which.
So he should still just
have to come around.
Right. So please come around.
Tell us what the issue is. I'm sure his information can be retrieved, and then therapies that are specific to what it is that's happening to him can be administered.
Okay. Okay. All right. And next one we have, please, sometimes I feel pains in my throat and it stops. This was, okay, yes, Antoine. I think I've read this one. Let's take our very last one and then we'll continue the conversation. In fact, I like this. My daughter at 4 put a pebble in her nose, which lasted for 21 days after scans at the hospital. Doc, is that possible?
It's possible.
Oh, okay. It wasn't noticed by the doctors. It dropped by itself after 21 days. Only God knows. Parents must be vigilant when children play outside.
Yeah.
This show is fantastic. Gamali from Chineri, Krache, in Chumuru, Oti region. Good morning. Good morning to you. I've actually been to Krache before, so good morning to you. Good morning to you. Okay, so keep your messages coming in. Let me go. Keep your messages coming in. Let's go on Facebook and let's see what's on there. There are so many messages. Doc, earlier, I think you sent a picture of a cockroach.
Yes.
A roach.
Yes.
Is it? Where is it at?
In the ear.
In the ear.
Yes.
Okay, so we'll get to that. All right, so I'm trying to get messages from our Facebook, those that are watching from Facebook. Let's see what we have. Let's keep scrolling and see. Let's keep scrolling. Hey, where are we on Facebook? Where are we on Facebook? Meanwhile, we are live, eh? We are live on Facebook. We are live on Facebook. Okay, so let's see. But Doc, let's continue talking about the cockroach. If our director can put the image of the cockroach in the ear, the cockroach in the ear, so we can have. Okay. Doc, let's talk about, you know, the cockroach in the ear. You would wonder, how is it possible? So was that a child?
No, this one was an adult.
This one was an adult?
Yes.
So how did the cockroach get in there?
Up in the ear. So this particular person in question, I believe, was sleeping on the floor. And sleeping on the floor.
Oh, sleeping on the floor.
Yes. So at night, insects are walking around, and then they end up in the ear. And it can be a very terrible thing, because here you are.
Okay, so that.
Yes.
Wow.
Yes. Here you are, an insect, a live insect, walking in your ear and constantly stimulating the eardrum.
Okay, so Doc, this is where I will tell you my story.
Tell me.
So this was some years ago.
Yeah.
When I was in the uni, I was in the hostel, and my window was open.
Yes.
I was lying on my bed, Doc. I was lying on my bed. I don't know what happened. Before I realized, I felt something moving in my left ear.
Wow.
And it was doing the sound. So it was obviously I was flying.
Charlie.
That was in my ear. Doc, I was uncomfortable because it will reduce the movement in the ear.
Yes.
Then the moment I try to, insert my finger and then all that, it
Then
starts
it
moving
starts
in my ear
moving.
again. It was highly uncomfortable.
Very, very, very.
Highly, highly uncomfortable.
Very, very. It will drive
And
you
so-
crazy.
Yeah, but something amazing happened.
What happened?
It ended up coming from my throat.
Oh.
I don't know how that happened.
Oh, that's
like
amazing.
I coughed,
Yeah.
I don't know how come.
Interesting. So it was in your ear.
It was in
and
my
it
ear.
ended up in your
Yes.
throat. Except that, there's a communication between the back of the nose and the middle ear. So if for any reason your middle ear, your eardrum is perforated and whichever thing ends up in the middle ear, then it can, because there's a communication there, then it can end up at the back of your throat and back of your throat, it will get into your mouth.
Oh.
And yes, you can, when you cough, you can
So
cough it out.
there's a possibility that
It's
what
possible.
happened in my
It's
case.
possible. It's possible.
Doc, it was highly uncomfortable.
Very,
So I
very
wonder
uncomfortable.
how, in the cases of children, how they
Yes,
would.
it would be so uncomfortable. In fact, there's one adult that I saw, and he was nearly going crazy.
Yeah.
Because the insect would move.
Yes.
And once the insect is moving about and other things, the noise and all the discomfort that he was
Yeah.
feeling. Plus, if you are unfortunate and the insect is also one that bites, like an ant, biting in addition to walking around
Walking
with all the nuisance that is causing in your ear, that can be so problematic. So that is, unfortunately.
Okay,
that's
so
some
Doc,
of the
we'll
things that
come
can
to,
happen.
there are some parents I know
Yeah.
that in cases where some of their children have foreign objects, whether they are nose, they try to use certain objects to take it out
take it out,
themselves.
yes,
So we'll
yes.
come to the no-go areas or don'ts when it comes to situations like this. But let's take a few comments
Yeah.
from our WhatsApp number. We have, hey, I'm Gazelle from Lashibi. Please, can you use earbuds? Okay, cause sore. Can earbuds cause sore in the ear? Please. Dr. Watson said it earlier that earbuds, cotton swabs, cotton buds are a big fat no for your ears. So please avoid them from today. Those of you who are fond of using cotton swabs, as for intakradi, person mekoho. The furthest stuff we use, because I know
It's amazing.
it's amazing, Doc. It's amazing the kind of things that we end up doing just so we can be
Charlie,
comfortable.
it's
Because the
amazing.
itching in the ear canal.
Yeah, it can be
So when there's
annoying.
itching, what do you do?
What we do is that, what we advise is that you massage your tragus. The tragus is this
tragus.
small one
Oh,
in
okay.
front of the ear. Massage it.
Just massage it.
Yes, massage it.
And the itching goes?
Yes, you actually, as you do it, there's some effect in the ear as you do it. And it should relieve you of the itch. Yeah.
Ah.
Yes.
Some
Because,
say that if you are doing that or if your throat is itching, anyway,
Yeah.
you're cocoa. Doc is laughing.
the point is that the thing called cocoa, I've been trying to look for the definition of cocoa since I heard it.
Then it means you've been hearing it a lot.
I've been hearing it a lot. And I don't know what the definition is.
Okay.
Because if you have a swelling in your armpit is cocoa. If it is
Yes.
in your whichever place is
Yes.
cocoa. If your eyes are itchy,
They
it's
say it's
cocoa.
cocoa.
So what is cocoa?
My Ghanaian people. Okay, so let's take some more comments. Hello, good morning. Please, I'm a lady of 28. Whenever I put eardrops in my ears, I get motion sickness. Please, can you ask the doctor what causes it?
The point is, which eardrop is this person putting in the ear? And for what reason is the person putting it in the ear?
Okay.
That kind of thing.
Okay.
That's the first thing that I want to know. And plus, if she herself has some ongoing pathology in the ear and other things, is the eardrum perforated, that kind of thing. So those are the questions that have to be answered before we can talk about why she's having this or
Okay, let's take about 2-3 more comments. Sorry. Hello, my child is 1 year. I've been using clean towel in cleaning his teeth, but always blood comes out of it. Please, what should I do? And how? Okay, so your child is 1 year.
Yeah.
Doc, is it advisable for her to even be doing that?
Using clean towel to clean the ear.
clean
Okay.
the-
Unfortunately, I'm not a dentist.
So you
So
can't
this is,
even
yes,
tell
outside
with
of
that.
my,
Yeah.
yes, outside
Yeah.
of my,
So I guess the blood is probably from the child's gum or something.
yeah,
So
possibly causing
yeah.
trauma, possibly.
We'll get you an appropriate doctor to answer your
Yes,
question
yes,
for
yes,
you.
Yes, get a
Okay.
dentist for her.
Yes, the next one. I have a 5-year-old boy who understands whatever being said, but does not speak in understandable words. Please, what could be the problem? I'm Mariama from Ho. Oh, 5-year-old. Wow.
Yeah, many things. And
Many
that's,
things.
yes, many things, many
Okay.
things. And I mean, at 5 years, if the presentation is what she's describing, then obviously the child is delayed. And we will need to delayed in terms of speech.
Okay.
Yes, and so he will need evaluation to evaluate the many things.
Okay.
That could be the reason for the child.
All right.
Yeah.
All right. Good morning. Please, my son has constant runny nose. What might be the possible reason? Because the doctor is saying it's nothing. Hey, some of you, I don't know which doctor now.
Yeah, but
'Cause you would
constantly
wonder.
having running nose is
Yeah.
not supposed to be normal. It's not. And many things have to be found, out. Constant running nose, a child also snoring, as I mentioned earlier, is it one that is offensive? Is the constant running nose from just one nasal cavity, or is both of them? All these things are important in evaluating this constant running nose. So obviously the constant running nose is not normal.
Okay.
And she has to be, the
You
child
need
has
to
be seen.
attend
Yeah.
to it, yes. Next one. My 4-year-old nephew swallowed 50 pesos coin, and we didn't know it. We didn't know. It took 3 days before it was removed in the hospital. Mariam from Kaswa. It
Yeah.
took 3 days.
It happens.
Wow.
It happens.
Let's move on to the
There
next
are some
one.
that take 3 months.
Sorry?
4 months. There are some that take months.
Months
Yes.
before it is removed.
Yes, months. 3 months, 4 months. For some reason, maybe they realize
And
the
no,
child is not.
no damages are caused.
Well, the longer it stays, the more problems it causes. Yeah. Some of them run at the time you are removing, others problems that follow you. And so that's why it's important we try and identify these things and get them sorted out as quickly as possible.
Can you
Yeah.
run us through the objects that could possibly come out themselves?
Okay.
Without, showing any, or the ones that would require surgery?
Okay, so as for coming out themselves, depends on the size of the object we are dealing with, the age of the child.
Okay.
Yes, so the older the child, the same way you increase in size and other things, the esophagus, that's the tube that your food will be going through, also would also be increasing in size. And so some things that are very small may end up being passed out. So a 5 peso coin, for instance, or a 10 peso coin in maybe, say, a 7-year-old
Okay.
may end up being passed out. And so for us, for instance, if you come with the history of my child has swallowed, and in normal Ghanaian parlance, the thing swallowed, it's a bit vague. But away from that. But if your child has ingested something, say a coin or something, just before we even go in to take, even though we would have had a previous x-ray that showed that the coin is there, before we go in, we usually take an x-ray again, a repeat x-ray, just to be sure that it's not being passed down. If it's been passed down into the intestines, that kind of thing, we know that the thing is on its way coming out. Okay. Under such a circumstance, we would not attempt to go in to remove it.
Okay.
Yes, that kind of thing.
In a situation where you are brought up in a typically local home,
Yes.
and then mistakenly a child, or let's say an adult, you
Yes.
swallow a foreign object,
Yes.
you would hear a grandmother or a mother say that, any minibanku, a baby piano manako.
Oh, that's true.
Yeah.
You are so correct. And especially things like fish bone. When mistakenly you have a fish bone that is stuck somewhere in the, as in the esophagus or the pharynx or something, it's a common thing. Take a bigger bolus of food and push it down. That's a common, and you'll be fine.
Yes,
that's
and
a
you'll be
common
fine.
thing. And for many people that come to the hospital eventually, when it has not worked, many of them, this is what they would have used. In fact, there are also some people that would be like, take tapoli. I don't know the English name, what we use in grinding pepper locally. And then massage the neck and other things, and then it will come out. And all kinds of things that people do. Parents, children that have ingested foreign bodies, parents may attempt taking it out themselves.
Yes, yeah.
But a quick word about the thing about taking a bigger bolus to push down, for instance, a fish bone.
Yeah.
You may be the unlucky one, in the sense that fish bones, depending on how they are oriented, sometimes, I mean, some of them may be lying just like this horizontally, others are vertical, some of them are oblique, you know, that kind of thing.
Okay.
And in your attempt to push it down, you may end up pushing it rather further, driving it further into the tissue.
Oh.
So you drive it further in, and around where the swallowing, I mean, the esophagus and the windpipe and other things are very big vessels, big, huge ones that are around that place. And if you are unfortunate and it ruptures, I mean, the fish bone, whilst driving through, rupture some of those big vessels, that may be your end. We may not be able to salvage you. And we've seen some.
Wow.
Yes, somebody has a history of having swallowed a fish bone and, you know, for whatever reason, has been at home for a while, blah, 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 that kind of thing. And the next time is that whilst we are evaluating this person, the person just starts bleeding torrentially. And it's because a major vessel
been a rupture.
yes, has ruptured. And you exsanguinate, as in you just drain all of your blood and you are out. So things as simple as fish bone may not be as simple as that.
Oh, this is really heartbreaking. Doc, briefly, I want you to help. I mean, parents especially.
Yes.
What are some of the things that you shouldn't do if your child
All
is
right.
to swallow a foreign object?
That's fine. So your child has swallowed something, whatever thing. Don't attempt inducing vomiting as a way of having to get it out. So some of them may give their child oil, palm oil or something to
that
drink
you would
in an
throw up.
attempt to, throw up and then bring it out. That's a dangerous one because in your attempt to make your child throw up and all, the child could aspirate. Aspirate means that whatever that is coming out can go into the airway. And if it goes into the airway, that's a dangerous situation. Your child will become very sick. So that is one. So aside the fact that that thing will not even come out, in addition, your child now develops a pneumonia and other things and becomes very, very sick. That's one. The other thing too is that there are some of the foreign bodies that are very dangerous, like some of them, the things that contain alkali, acids, and other things. Yes. If this your child, first and foremost, the tissues have been exposed to this
I
thing.
wish we could continue this because this was getting more interesting and more educative. Unfortunately, this is where we have to end,
That's
but we'll
fine.
definitely come back to
No
continue with this.
problem.
Viewers, this is where we end a Good Living segment right here on Prime Morning. And this is where we end the entire edition for today of Prime Morning on Joy Prime. My name is Esiodua Kumia. For Good Living segment, my guest has been Dr. Kwabena Agyenim Boateng, who is a resident ENT surgeon. Stick and stay with us right here on Joy Prime because there are so many programs that you would love to watch. My name once again is Esiodua. I didn't do this alone. KMJ, the royal host, was here with me. See you tomorrow at 6 a.m. Bye.